Okay, good morning, everybody, and good afternoon and good evening. My name is Judy Stenmark. I'm the Director General of the Global Self-Care Federation, and a warm welcome to everyone for this special webinar on self-care literacy, empowered people, better decisions, and resilient healthcare systems. So, just a few housekeeping rules before we start. Next slide. Yep. Okay, so all participants will be muted. However, you can put your questions or in the chat, and also we will have a Q&A session at the end of all the presentations. So questions can be put in at any time, but they'll be addressed right at the end when we have our group discussion. Also, this webinar will be recorded and will then be shared on the GSCF website afterwards. Next slide. So here's a lineup of our speakers. We have a fabulous, esteemed panel, I would say, for today. I'd like to introduce Dion Shumbi, who is CEO of Consumer Healthcare Products Australia, and he is also a board member of the Global Self-Care Federation, an executive committee member. Next, we have Christine Sorensen, who is the founder of Global Health Literacy Academy, International Health Literacy Association. Over to Faten Ben Abdelaziz, who is head of the Unit of Enhanced Wellbeing at WHO. And our final speaker is Oratit Bamrung Sakul Sawat, who is a board member of IAPO, the International Association of Patient Organizations, and also Assistant Secretary General of the Heart to Heart Foundation from Thailand. So we have a really good lineup and we're really excited about today. Next slide. I just want to run you through the agenda just quickly. I'm doing just a brief overview of our organization. Then Dion will be talking about what is self-care, what we believe self-care is, and the importance of health literacy in terms of self-care. Christine will then be introducing highlights from our newly produced, it's almost fresh off the printers, our new white paper on self-care literacy and its main findings. Fatin will talk about WHO insights on health literacy, which will be good for everyone to hear. And then we'll have the patient voice from Oratit. Next slide. So I'm just going to go into a little bit, as I said, about who the Global Self-Care Federation is and what we do and what are our key objectives right now. So we are a trade association representing manufacturers and associations in the self-care industry, and we are committed to better global health outcomes for all. And we have a mixture of federal, national, regional, and multinational associations. We have been in official relations with WHO since 1977, which is one of our most important relationships, and we've been established since 1970. Next slide. So this is just an overview, if you like, of our members, and you can see we are truly a global organization, but all working towards the same agenda. Next slide. So our mission and vision, a healthier world through better self-care, and really to be the trusted global partner creating the right environment to promote the wider adoption of self-care. And that's something we do very much so with WHO. And to ensure evidence-based self-care products and solutions are recognized as a key contributor to health for individuals and systems worldwide. Next slide. So this is just to show you what are our key initiatives right now. And up the top, you'll see that what we're really driving to, what our major ambition is, and this came about through lots of consultation last year, is a WHO resolution on self-care. Now, Faten might be surprised to see that, but really, we believe that we may not get that resolution, but everything we do to try and get there, every document we produce, every bit of research, every policy piece we develop with our stakeholders and associates will help us get self-care to where we believe it should be. So if I just give you a quick overview of our strategic initiatives, Firstly, evidence-based self-care. We have to be able to show what is the evidence for self-care. It's okay for us to say self-care is important. We believe it's important, but what is the evidence for that? And I think that's something that we've really been talking again to WHO about a lot. So we launched last year our Self-Care Readiness Index, a very important document showing how we can enable self-care around the world. And then we're working on, and soon to be launched, a global study showing the economic and social value of self-care. Other strategic initiatives, self-care literacy, I'm not going to go into that. Environmental sustainability, we launched our charter for an environmentally sustainable self-care vision last year. First time for our industry, and now we're working on how we promote that and what we do with that going forward. And then lastly, self-care health data. How can we show the value of using self-care health data? What value does that bring to individuals as well as to systems? And that is a huge area, a complicated area, but we're working our way through it. I think that's my last slide. So now it's with pleasure that I hand over to Dion Scumbi, as I said, our board member, who is going to talk us through self-care and health literacy. Thanks, Dion.
Thanks very much for that introduction, Judy, and good evening from Australia. Good day to everyone in the rest of the world. Can I join Judy in thanking you for joining us for this discussion? As you heard, we're going to be talking about health literacy generally and self-care literacy specifically. But before we get there, I'm going to take you on a short journey of how GSCF, Global Self-Care Federation, got to have health literacy and self-care literacy as a strategic objective. Next slide, please. Okay, so self-care has been a key strategic focus for GSCF for some time now, and we've been working with stakeholders, including the WHO, as you heard from Judy, to gain recognition for the value of self-care, the value for both for individuals as well as public healthcare systems. The ultimate goal is the adoption of self-care in national health policy. In the course of our work, health literacy emerged as a critical determinant or enabler of self-care, and this led us to broaden our strategic focus and advocacy efforts to improve health literacy through policy change. Next slide, please. I think we should first agree what it is that we mean by self-care, because self-care means different things to different people, as we've discovered in our discussions. There are several definitions of self-care, and the concept encompasses a broad range of behaviors and activities, as you can see on the right-hand side of the slide there. We use the following or shortened WHO definition in our discussions with our industry partners and stakeholders. Self-care is the ability of individuals, families, and communities to promote health, to prevent disease, and to maintain health, and to cope with illness and disability with or without the support of a healthcare provider. Next slide, please. A useful way of conceptualizing self-care is to look at it as a continuum. On the one end, you have the daily activities and decisions that individuals make independently about their health. This includes the management of common ailments with, for example, non-prescription medicines. Then we move across the spectrum, and then you find participation of consumers or patients in the management of more serious, acute, and chronic conditions. And at the extreme end, you have very little or no self-care in the case of, for example, serious acute trauma. Next slide, please. So why would we be talking about self-care? Let's consider the value of self-care. Self-care is often taken for granted, which means that the health economic value is not fully appreciated. From a public health perspective, self-care plays an important role both in terms of beneficial impact on individuals' health, but also on healthcare systems. Let's look at individuals. The capacity to self-care, including the ability to make informed decisions and appropriately use available health resources, is an essential component of the effective prevention and management of disease. Increased self-care activity can also contribute to improved mental health well-being, self-efficacy, and the autonomy of individuals. And this is of particular importance amongst vulnerable populations. From a public health system perspective, there are many advantages to enabling, promoting, and supporting self-care. Self-care is a cost-effective and logical approach, for that matter, that can reduce the disease burden in relation to preventable health conditions, consequently easing the pressure on health systems and ultimately improving health outcomes. The Global Self-Care Federation and its members have invested heavily in research to demonstrate the value of self-care and to build the evidence-based supporting of self-care. Judy mentioned a new study that we commissioned that will be published or launched shortly. Multiple studies have demonstrated the value of, for example, non-prescription medicines and the savings on the public health system in terms of doctor visits and productivity gains through time spent off work and in waiting rooms in doctor's surgeries. Next slide, please. Great advances has already been made in this area and in gaining recognition for the value of self-care, and it's already been embedded in several international frameworks, most notably those of the WHO. And I mention a few: the WHO guideline on self-care interventions, the Declaration of the General Assembly in relation to the prevention and control of non-communicable diseases, the health workforce, and the Shanghai Declaration on Health, amongst many others. Next slide, please. We believe there's an urgency to accelerate the uptake of self-care in public health systems. Why do we say that? The need for the adoption of self-care in national health policy has been highlighted by the COVID pandemic. Protecting the health of the public during the emergence of new threats from infectious diseases requires a high level of self-care by individuals in concert with supporting government-led population health policies. We're all familiar with social distancing, wearing of masks, hand hygiene, quarantine, etc., etc. Those are all self-care activities. Secondly, as mentioned earlier, self-care results in better use of scarce healthcare resources. It can free up resources that can be redirected to more serious conditions. It provides more cost-effective healthcare interventions, which in turn contributes to the sustainability of public healthcare systems. And we all know how important that is with the increased burden of disease associated with the aging population. Furthermore, it's a critical component in prevention and management of chronic disease, as we have said before. And lastly, it makes, we believe, important contributions to the goal of universal health coverage. Judy mentioned the Self-Care Readiness Index. The next slide, please. So I would like to just tell you a little bit more about the Self-Care Readiness Index. We launched this in 2021 at the time of the UN General Assembly. The Self-Care Readiness Index is a research and policy initiative that explores the critical enablers of self-care across health systems around the world. It aims to engage with stakeholders to build partnerships to advocate for policy change that will result in action-oriented initiatives at all levels to improve healthcare systems. Next slide, please. I mentioned briefly the four enablers. The first is support and trust amongst stakeholders. By stakeholders, we mean healthcare providers, patients, consumers, regulators, and policymakers. Secondly, self-care health policy, the extent to which policymakers recognize and support the economic value of self-care. Thirdly, regulatory frameworks have a significant impact on the ability to deliver self-care, both for healthcare providers as well as for industry. The enabler that is critical to or important to our, or relevant to our discussion today is consumer and patient empowerment. And the key insight which emerged from the work that we've done in this area is this: self-care delivers the greatest value when consumers and patients have a high degree of health literacy. That means they appreciate the value and prevention, and they feel confident and empowered to make appropriate decisions about their health. Next slide, please. This insight, along with the work of WHO that's been done already, set us on a course to collaborate with primarily, first of all, with WHO, as well as other stakeholders with a shared interest in health literacy, to jointly identify opportunities to improve health literacy globally through policy change. Our objective is to support the WHO in demonstrating the value of driving health literacy generally and self-care literacy specifically to enhance self-care. I now hand over to my colleague, Christine, to talk to you about health literacy and self-care literacy. Thank you.
Thank you so much, Dion. And it's such a pleasure to be here and work with the Global Self-Care Federation as a health literacy champion, a global health literacy champion. My name is Christine Sørensen. I'm the founder of the Global Health Literacy Academy. I'm based in Denmark, and I'm also the president of the International Health Literacy Association. Next slide, please, for the start. I've been working in the field of health literacy for a decade now, and health literacy entails the knowledge and motivation and competencies for people to access and understand and appraise health information, to form judgment and make decisions in everyday life when they're ill. So in terms of healthcare, when they try to avoid risk, disease prevention, and when they try to stay healthy. So in terms of health promotion, to maintain and improve quality of life. And health literacy is developed during the life course. And we can talk about health literacy really as the capacity to make sound decisions in the context of everyday life, at home, in the community, at the workplace, as consumers, in the healthcare system, the marketplace, and as a political agent. And that's where it's fantastic now to look at health literacy in the context of self-care. Next slide, please. And why does self-care literacy matter? It's because we have seen from our research that health literacy is, of course, about knowing how to find, understand, use, and judge information to take decisions and to act when you have, for example, minor ailments, or you feel something is wrong, or by your personal factors, age, education, gender, also where you live, love, work, play, situational factors, and wider societal and cultural factors. And then we can see that people with higher health literacy, they use health services differently. They have other kinds of behaviors. They have, they engage differently in their own health, in other people's health, in the health of the community and the society wherein they live. And we do see a very strong social gradient, unfortunately, related to equity and sustainability. So those with lower or limited health literacy, lower levels of health literacy, they are also at risk in terms of using healthcare services much more, have worse self-reported health, do not engage as much in screening programs, vaccination programs, and so on. And often they have also a lower income, they are lower educated. So all in all, they are faced with a higher health literacy burden than those who are have more capability to manage their own health and the health systems. Next slide, please. So it has been a pleasure to work with the Global Self-Care Federation to see how could we increase the awareness of self-care and health literacy, and we call this now the Self-Care Literacy Agenda. Next slide, please. So we just heard that according to the World Health Organization, self-care is the ability to maintain and improve one's health and prevent and limit illnesses and address self-treatable conditions. So these are the things that we most of the time do outside the healthcare system. So on our own, based on advice from family, from friends, from media. And that's why it's so important to be able to distinguish what is correct information, what is timely information, what is relevant information. And it's also closely related to other subtypes of health literacy, like medication literacy and disease-related literacy. Next slide, please. And in our scientific review that we have done for the Global Self-Care Federation, we started health literacy and self-care literacy in relation to the consumer journey per se. And we could see that there are different behaviors and different attitudes depending on your skills, your level of health literacy skills. Next slide, please. So those with higher health literacy, they, interestingly enough, they have many more resources. They are more health-oriented than disease-oriented. So they focus on health promotion measures and try to improve their health. They have a higher degree of product awareness, are more able to choose and be maybe their higher levels of critical thinking about marketing and adverts, especially also online. And they are more often open and transparent about their own health behavior and their medical history. And they are more eager to engage in education and campaigns, and so they understand, let's say, the importance of improving one's own health. On the other hand, limited health literacy levels for those people, they have more focus on treatment and disease prevention, and I think that relates very much to the research I told about in the beginning. They're more often ill, they use the health services much more, so that's dominate their world and their daily life in a much higher sense than for the health literate people. They are more following instructions of the GP, less taking decisions on their own. They might also have those difficulties in understanding complex medical matters, and their self-esteem and self-confidence is lower than what we see among those with higher health literacy. Next slide, please. So we want to help put self-care literacy on the agenda. We want to change the situation. We've heard from Dion that self-care, and we also know from health literacy, it's big business, and it's everyone's business. Because we do not have a good match between what people need and in terms of support to maintain and improve their health. They will use the system more, they use services more, they may not come in time to help them, and that will create more costs. So we need to help improve that better, or improve the match between people's needs and skills and what we offer. And that's why we have identified 4 action areas that we encourage organizations, providers, decision makers, policy stakeholders to engage in. One is about like the Global Self-Care Federation here, become a health literacy champion and advocate for self-care literacy. And we also encourage to create awareness about the agenda, because we do see that health literacy and self-care literacy is a way to bridge the gap of inequity. And we support a global action. So, for example, the organization in which I'm president, International Health Literacy Association, we are also looking for other stakeholders to make alliances, for example, with the Global Self-Care Federation and other stakeholders. And we already work very closely also with the World Health Organization on the health literacy agenda. And then it's about information and communication, down to the details. Can we improve the way we communicate with the citizens, with the consumers, and can we put extra attention to make sure that we make a particular focus on reaching at-risk groups or people in vulnerable situations, to reduce health literacy inequities, and also strengthen the capacity building among staff. So it can be among the healthcare providers, pharmacists, social workers, to pay more attention, teachers, pay more interest in how we can promote health and well-being. And we have not spoken so much about the digital health literacy skills, but self-care literacy is definitely very closely related to digital health, because much information nowadays comes in a digital manner. And lastly, we want to highlight it's important to generate more evidence of what health literacy, the state of health literacy in countries, in societies, in neighborhoods, because then we would know which kind of interventions that are needed to help those groups that are in need, and also in a way to monitor how the progress is. So that's a call to action. And I want to say thank you to all the partners here in the panel. I'm very pleased that we can have the discussions here to see where are the challenges and where are the opportunities to drive this agenda forward. Thank you so much. And may I now hand over the word to my colleague at the World Health Organization, Faten Benabdelaziz. Thank you.
Thank you very much, Christine. And I would like also to thank the organizers of this very important workshop. I must say this is a timely one. So I am Faten Benabdelaziz, and I head the unit of enhanced well-being at the WHO headquarters within the Department of Health Promotion. And I would like to highlight that I will be emphasizing on the work that we are doing within the department, although acknowledging that many departments in emergency, in the universal health coverage, in health systems, in multiple departments are also talking about health literacy. One way or another, they are trying to promote health literacy, but in my presentation, I will focus on the work that we are doing within the department. Next slide, please. So I would like to present a little bit about, again, some of the definitions and descriptions of health literacy that we are using to advance our work. Also give you some documents that we are somehow building on to guide the work of health literacy, and also share with you some of the plans on moving forward in for a health literacy agenda. Next slide, please. I would like also to acknowledge that the work that we have been doing in health literacy at WHO has been the contribution of many experts around the world. So Dr. Christine Sorensen has been our senior consultant within the department, as well as a partnership with Goethe Institute, the Technical University of Munich, Sydney University, and many other partners. So many of you have probably heard about the glossary of terms for health promotion that has been produced by WHO. And last year we launched a new version, the updated version. And you can see that in the definition that I'm displaying before you, there is a slight, again, expansion of the definition. So health literacy represents the personal knowledge and competencies that accumulate through daily activities, social interactions, and across generations. And here I would like to highlight that while we are speaking about self-care, we need to also acknowledge that the sources of information are not one. There are multiple sources. I come from a country where medication and treatment are sometimes shared between neighbors. And even the words of a general practitioner is challenged. So, and this is without talking about, let's say, again, what is available on the internet. So we have been speaking about personal knowledge, we have been speaking about competencies, but in the area of health literacy within WHO, we really, and within health promotion, we really speak about empowering people to make the decisions, the healthy choices, but also creating the conditions for them to do that. Next slide, please. So it's about health literacy is the capacity to make sound health decisions in the context of everyday life. And I took the choice, the liberty to share with you different definitions so that it triggers a little bit some reflections on the fact that different aspects and angles of health literacy have been highlighted according to the definition, in addition to the definition that was put forward by Christine earlier. Next slide, please. Next slide, please. Thank you. So in the work of health literacy, even though we use one concept, it is important to highlight the different levels of health literacy. In the work that we do within health promotion, as Donna Bean has highlighted, we are working more on the development of critical literacy. You can see in the context of emergency, for example, we talk a lot about, again, health literacy in providing the information and providing education, pedagogic materials for people to develop those skills to actually protect themselves. And we are trying to really move to empowering action on health literacy to empower people and then act on the, I would say, the decisions that are before, let's say, that are creating a risk in the first place. So here I would like to just highlight that we have the basic functional literacy, which provides sufficient basic skills, but also assumes that everybody has the capacity to comprehend the information that is being put forward. The second is communicative, interactive health literacy, where there is somehow an exchange between the physician, but also the patient. But the third one, as I mentioned, is the one that we are trying to expand and that we are trying to emphasize on. Why? Because we are, with the rise of NCDs, it is important that, let's say, consumers associations have actually the knowledge to act and influence on some of the decisions, some of the policies that are hindering their health. Next slide, please. So really what we are trying to do within the organization is to move somehow from basic health literacy, health education to really health literacy in an empowering manner. So I have put those slides for you to make them available to you, but because of time constraint, I won't go through them in a thorough manner. So next slide, please. Next slide, please. So on the thank you. So why, next slide, please. So why does health literacy matter in the context of the work that we are doing but first, it has significant negative impact on health, as was presented by the speakers before me. It exacerbates social gradient, as Christine mentioned, and induces high level of healthcare cost. Next slide, please. So this is from the work that has been done by the WHO Office for the European region, showing the different social gradients when the level of health literacy is limited. Next slide, please. So there is, as it was mentioned earlier, and some countries have put a cost in for health systems when there is limited health literacy. So, for example, the colleagues from Canada have estimated that more than 8 billion is the cost due to limited health literacy. In the US, 73 billion was required due to limited health literacy. Again, this study is coming from the Health Literacy Solid Facts, but we can say that investing on health literacy is actually critical to maintain functional health systems and healthcare. Next slide, please. So what works for improving health literacy? Comprehension of health information and advice. So indeed, we need to, and you all know that, we need to consider the patient not as an active recipient of the information that we are providing, but really as again an individual who is who has a choice. In some countries, we can say that in some countries, sometimes the general physician is perceived as God, and you don't contest what the information is provided. But we also know that for complex conditions, you need to understand the context in which the client is supposed to take the medications. You need to know about the social environment. So for that reason, the way you interact with the patient is, and to ask the patient to really take care of themselves is critical. Next slide, please. So there are 7 key principles of health literacy. It has to apply a life course approach. It has to acknowledge the multidisciplinary constituents. It needs to consider the equity dimension, and I think it was mentioned many times during this session. It has to promote positive approach to generate that motivation that is required to sustain the actions. It needs to engage the community, and it has to be supported by a monitoring and evaluation component for the interventions, and it should generate some long-term benefits. Next slide, please. Thank you. So moving on.
One minute.
Thank you. So moving on maybe very quickly to the meat of what we are doing. If I can skip some of the slides, and next slide, please. So I'm making those available for you to have them whenever you have time to view them. And I will move straight to the 10th Global Conference on Health Promotion. So where health literacy has actually been really mentioned was at the 9th Global Conference. It was seen as a health promotion approach to support the SDG agenda. And at the 10th Global Conference, it has been highlighted that health literacy is critical to building healthy societal well-being. And if we, in the area of health promotion, we are working towards 2 things: the development of a global agenda on health literacy, and self-care has to be a critical component. But we're also working with colleagues in the development of a measurement tool to measure levels of population, population level health literacy. And in there, what we would like to say is that any public health policy should be informed by the level of health literacy of its population. And before closing this session, and I apologize if I was not able to cover all the slides, but I would like to just highlight 2 things. The first one is that when promoting self-care, health literacy and self-care, it's not to shift the burden of care. It's not to shift the responsibility to individuals, but really about creating this environment, those instruments that are needed for a person to take the right decisions. We need to pay attention to the context of the different countries, the family context of the individuals, the community context of the individuals, so that it is relevant and it is possible for people to take care of themselves. So thank you so much, and apologies if I was over time. And I would like now to hand over to Dr. Oraji. Thank you very much.
Uh, Good morning, good afternoon to everyone. Thank you for allowing me to speak about patient self-care literacy. I'm the board member of IAPO, or International Alliance of Patient Organization, and also I'm working for Heart to Heart Foundation, Thailand, and we are a patient advocacy organization. Talking about patient self-care literacy. Next slide, please. The IPO has a study and provide policy about health literacy that it includes an individual's reading level as well as language, education level, and cultural background and readiness to receive health information orally or visual means. And all these factors may create barrier to understanding and limit a patient's ability to take action to improve their health. Therefore, health literacy involves comprehending and taking appropriate action. Poor health literacy can mean treatment is ineffective. And providing effective patient information means acknowledging, understanding, and overcoming barriers to health literacy that individuals might experience. Next slide, please. So patients' needs and ideas to improve self-care literacy. That means patients can strengthen their knowledge of healthcare process and mechanism by relying on accurate, comprehensive, and easily understandable information. That is important. And making patients better aware of the available choice and option. High quality information will enable them to make informed decisions and meaningfully contribute to decision-making process. Patients cannot truly take charge of their own healthcare if without information. And all the more crucial for patients to develop an ability to assess and evaluate the credibility of the information they receive. Next slide, please. Now talking about self-care in healthcare system in Thailand, we can see that self-care will improve health and prevent from disease and sickness, especially in aging and chronic disease group. Self-care costs lesser compared with medical treatment costs. It will improve economic outcome, including health system cost effectiveness. In Thailand, self-care is promoted and well recognized, both in policy level by the government and the universal health coverage and private sector and in community nationwide. People and chronic disease patients are more educated right now and practice self-care personally and in patient group with guidelines disseminated widely, both digital and non-digital channel, especially in this COVID-19 pandemic situation. So self-care activities practiced in communities are promoted and advised by community health center and health volunteers in every community in Thailand to the people and patients. Next slide, please. And we have developed many documents or many tools for patient self-care literacy. Patient was educated both in the hospital, and here you can see that the health volunteers will work closely with the professional in the hospital to provide self-care literacy to the patient in the hospital and also the professional together. And they also provide self-care literacy in the community by the health volunteers. And we also have developed many guidelines for self-care like this one. by our foundation with the National Health Security Office. It's about guideline for cancer disease self-care literacy. Next slide, please. And talk about self-care during COVID-19 pandemic situation. In Thailand, self-care play an essential role due to COVID-19 patients have faced difficulty of access to healthcare service. And especially last year, we have many problems and difficulty to get access to healthcare service of those COVID-19 patients. So patients have to practice self-care at home, or we call home isolation, with advice by telehealth or telemedicine from the providers. It helps a lot. And we also have medicine, medical device, and food sent to their homes. And if the patient have critical situation, they will be sent to hospital by referral system in case of emergency. And the government health insurance will cover the cost of self-care in those cases, which lower the burden of patient exactly. Self-care have to be included in healthcare system and health insurance much more. And this they will develop furthermore by the patient together with the government and the professional. Next slide, please. And the health education and digital health are necessary, especially during this situation, to provide to people and patients. Policy advocacy and empowerment of the patient group in self-care are needed in order to change individual health behavior and improve health condition. And we can see clearly at the moment. And the good collaboration with healthcare providers will create more effective and continuum of care. Next slide, please.
1 minute, Aratit.
Okay. We have developed guidelines for COVID-19 vaccine, have types of antigen test kits, and guidelines for hand washing during a day to the people widely. Next slide, please. And also have developed self-assessment by application to those at-risk patients if they can check if they think that they are risk from the COVID-19 disease. Next slide, please. And also have guidelines from isolation for home isolation practice. Next slide, please. And also for those who are in the home isolation system, they will monitor by the medical staff every day, twice a day, and the food and medicine and necessary medical device will be sent to the patient at home. Next slide, please. And they also have screening in community before the people coming to the community, with collaboration with hospital, community health center, and health volunteer. And this will help a lot to prevent from COVID-19 disease to the community. Next slide, please. I think the last one. So the new partnership framework and sharing of responsibility are emerged during this situation. They are public, private, and community partnership for screening of COVID-19 patients, for vaccination accessibility, for field hospital, for home isolation, community isolation system, telehealth, telemedicine, COVID-19 patient data link to the hospital from community, and digital health application also developed. Patient care volunteer, they have many patient care volunteer, and good and consumer goods and delivery to the community and to the patient. Next slide, please. Okay, so that's all. Thank you for your attention.
Thank you so much, Aratit. I would ask all speakers and panelists to come on camera. Thank you. All right, let's get straight into our Q&A. Here's a question for Fatin. Fatin, several people have asked. I think everyone agrees this is a critically important topic for everyone to improve health and around the world. Do you have some concrete thoughts on how we can improve health and digital literacy? Because you mentioned we must invest more, and it's critical to invest in health literacy, self-care literacy. But where do we invest and how? I know that's a very broad question, but people want to know specifically what's it all about? Is it health education at the grassroots level, or what are your thoughts?
Thank you very much. So the primary investment is first to have a better knowledge of, as I mentioned, the level of population's health literacy. We don't know enough. So if we are going to prescribe any, I would say, preventive action, we need to know where the levels are, where the bottlenecks are, and what if our interventions to raise the knowledge and the skills of the people are actually adequate and relevant. So that's the first investment in a tool in assessing at national level population health literacy. The second is in making the information a little bit more user-friendly. And we can see that in many countries for several diseases, they try to use strategies to make it more understanding. So they use pictures, they use colors, but at the same time, and I was very happy when in the presentations of the previous speakers, I could see that it was not singled to the client, but also to the family and the context. When people are living with conditions that require support from family members, it is important that also the conditions of those family members giving the support are also considered in the national policies. I will say one French word, but it's a Canadian expression, which is about detached, les femmes détachées, detached women, because they have to care for a family member and then give up on their employment, for example. So these systems should be also considered when we speak about self-care. Thank you. Over to you.
Thank you so much, Fatin. And I think, yeah, the idea of pictures, making it simple, but as several people have mentioned in the chat, having it in the language, the appropriate language. And I think we're all amazed when it's not like that around the world. Here's a question or a comment that we need from Christine. I guess it's all about behavior change and health education. And we all know that changing people's behavior is difficult. And the people that should go to perhaps health education seminars in downtown Lagos or Beirut or somewhere like that, they're not the ones going. It's the people we need to get at that aren't attending these things or not going online or seeking help or better information. So this question is sort of a mixture of several about behavior change. And how can we strike while the iron is hot and target the right people at the right time with better health education?
Thank you very much.
Difficult one.
Easy question. No, easy said, but not easy done, of course. And I think we really have to start with us rather than speaking about them. I think being engaged in NGOs like myself, industry, governance, we need to make it easier for people to act in ways that will help them, help their health and well-being. And that's by lowering barriers. So it could be, for example, as mentioned here in the chat, how do we make sure that information, leaflets and campaigns and so on is easy accessible? It could be through translation, so that it's not only in the mother tongue of a country, but also in several other languages where there might be ethnic groups or immigrants and so on, that it needs to be translated into several languages. And also we should not be mistaken that there might be people who are really highly health literate, but they do speak another language. So sometimes just by the translation, we solve the problem. Other times it's about making it much easier. So for example, instead of presenting long sets of PowerPoints, you can show people what they have to do. We saw this in my local municipality where they were teaching young parents how to care for their children, and normally the nurse would come with a long presentation, and many of the people who are getting parents in a very young age, they are not literate and not highly educated, that we know from statistics from a fact. But by showing them, having a doll, having a bath, and so on, they were able to communicate in a much better way. So we have to be creative, and we have to also be brave enough to admit that we're not doing a very good job yet, and we have to improve ourselves before talking about improving them. Over to you, Judy.
Thanks, Christine. And I think Arijit gave some great examples of what her group is doing in Thailand. And that's what we need, some concrete examples. So thanks for that, Arijit. Maybe we'll finish off with a question for Dion. As someone who is the head of when I say local, a national society, can you give some concrete examples of what you're doing at a national level? And also what you think is the most important thing that national organizations can do, because let's face it, that's where the change starts, at the grassroots level.
Sorry, you asked me or asked Dion?
Dion, sorry, that was a question for Dion.
Judy, I'm sorry, what I dreaded happened. My connection dropped, so I got it reconnected at the end of your question. Sorry, can you just rephrase it, please?
Yes, just quickly. Can you give some examples of someone who heads a national association? What are the most important things that a national association should do? Should it be education programs? And can you give some examples of perhaps things that you've done in Australia? Because we think things change and we can see change at a grassroots level.
Look, the first thing, what we've been doing in Australia is the same as what's been happening at global level, is to try and build alliances and partnerships to get an appreciation and recognition for the value of self-care and the importance of policy. What we need is the government to enable the space where individual stakeholders can do what they need to do, industry. Things that we can do from a practical perspective, if we consider that our product labels is the primary source of information, we have to ask ourselves the question, do consumers understand the product label adequately? And we need to involve them in the design of it. We need to test it, to research and make sure that it actually works.
Okay, thank you, Dion. I think you've frozen again. So I think I will do the concluding remarks, because Dion's lovely smile is frozen on the screen. It is for me anyway. So what I'd like to do, it's 11:01, and I think Kawaldip, the head of IAPO, has just put in something in the chat about QR codes, great for self-care. And I think that's a good point, Kawaldip. And there's so much we can do in terms of digital health literacy, digital self-care literacy. And I think that's something we're looking at. And again, Arijit mentioned some great examples of what she's doing on the ground in Thailand. So with that, Dion, unless you're back, I'd like to conclude this session. I think it's been a really fruitful session, and we've heard some great perspectives from all different sorts, coming from all different areas, from NGOs, from IAPO, the Thai Heart to Heart, and then from researchers and from WHO, and of course Dion running it, the Consumer Health Industry in Australia organization. So I think we'll close that there. and we'll have all the presentations available. I want to thank all our speakers. It's been fabulous having you on, and let's do it again. Thank you to all.